Well, good afternoon. From day one, I've been clear. We'll use every tool in our toolbox. We'll take every step possible. We'll do whatever it takes to beat COVID-19. We're taking immediate action based on the best available data from our top experts. Earlier this week, I said you deserve the same numbers, the same information that I see as Premier. And yesterday, you saw those numbers. They were stark and they were sobering. We all know now that tens of thousands of lives are at stake. But we also know that we collectively have the power to flatten the curve and save lives. The numbers clearly showed that together we've saved thousands of lives. But we also know that we can't stop now. Yesterday's numbers showed us what happens if we succeed and what happens if we fail. Right now, as a province, we are in a fight of our lives. And the difference between winning this fight and losing this fight is the difference between life and death. And in this battle, we won't leave anything on the table. That's why this afternoon, we will issue another province-wide emergency alert. The message will be clear. Stop the spread. COVID-19 can be deadly. The time to act is now. Everyone but essential workers need to stay home. Only go out if absolutely necessary to pick up groceries, prescriptions, or go to the medical appointments that you have. Ignoring self-isolation or physical distancing advice can have devastating effects and endangers lives. Protect yourself and others. Stay home. If it takes standing here every single day, if it takes mass messages to every single person in Ontario to save even one life, I'm prepared to do that. And we took further action yesterday to direct more businesses to close or offer contact-free services. And before I continue, I just want to say, I know we've all had to make sacrifices. Daily life has ground to a halt. Companies and workers have lost their livelihoods. We've asked most of you to stay home, and I know many families are worried about their income. These have been tough decisions to make, but they're the right decisions. And I want you to know we're doing everything we can to bring an end to this pandemic. To the hardworking men and women still working to keep our province running, I also thank you. We need to make sure everyone still has the access to the food, medication, and essential supplies they need. And we couldn't do that without you. As I've said before, Ontario has some of the strongest supply chains in the entire world. And that includes our province's food supply chain. I can't thank them enough. You are my heroes. Thank you to our farmers. Thank you to the folks working in the process factories. Thank you to our truck drivers, grocery clerks, all those working in bakeries and cheese factories. To every single person who is helping to keep the shelves full, from farm to fork. Thank you, and God bless the people of Ontario.
Okay, we'll move to the phone line. First question.
First question comes from Cynthia Milligan from City News. Please go ahead.
Hello, Premier. Jamie noticed on his way in this morning that many shops along Yonge Street have been boarded up. I have a restaurant owner who says he's been broken into 4 times since the restrictions began, which is very unusual. He says he's being looted. Are you concerned about looting breaking out with fewer people around at night, and what measures can be taken to stop it?
Well, we've had many conversations with the chiefs of police. My Solicitor General has daily conversations, and it was a concern. I mentioned it yesterday. We have to make sure the supply chain continues. It's absolutely critical that we have food on the shelves and essential items on the retail shelves. If you don't, you have civil disobedience. Turns into anarchy, and that's unacceptable. We aren't that type of people. There might be the odd person, I say the odd bad apple out there, but there's no reason to be breaking in anywhere. We have enough supplies. We have the food. You might have to wait in line, like all of us do. I know my wife waited for, she said 45 minutes in line the other day when she had to go get food. We're all doing it. So please just follow the instructions of the retail chains when you go there, and everyone's going to be able to eat and have the supplies they need. We just have to be a little patient.
Okay, and my other question is about truck drivers. I know you've spoken to support them regarding the use of washrooms, but we also have a long-haul truck driver who goes back and forth across the border into the U.S., and he's concerned that he's not getting any guidelines in terms of isolation protocol. And he says there are poor conditions south of the border, people not knowing how to curb the spread, and he's quite concerned about bringing it back here.
Yeah, and I've heard that too. I've mentioned this concern to the federal government for the border agents on our border. What I understand, truck drivers are exempt when they come back and forth, because really they're just picking up a load, loading up, and heading back out again. And what I understand, there shouldn't be any issues at the border. But I'll mention it again. I'm getting on a call with the federal government after this meeting, and I'll make sure we get that clarified.
Next question.
Next question comes from Travis Dunrash of Global News. Please go ahead.
Hey there, Premier. Global News has obtained documentation directing long-term care homes to keep patients exhibiting symptoms of COVID-19 in the facility and not transport them to hospital. Can you confirm that long-term care patients are being blocked from going to hospital? And if so, why are we not doing everything possible to help our most vulnerable recover?
I'll pass that over to the Minister of Health.
Well, we are doing everything that we can to protect our most vulnerable. We want to make sure that we can keep residents in long-term care safe, but we know that there have been some outbreaks. But what we're going to do is to increase the testing in these facilities and make sure that we do the contact tracing and follow-up. We've got medical students that are prepared to help us. But I think if people are ill enough that they need to go to hospital, of course they will be transported to hospital. If they are showing symptoms of COVID-19, if they've been diagnosed with it, but they can be maintained in self-isolation within the home, we'll do that too. But no one is going to be denied access to health care if they need it. If they need to go to hospitals, of course they will be taken there.
So, Minister, how do you explain this directive then given to long-term care homes? And also, has the ministry directed nursing homes to have conversations with family members about these directives? And aren't we just leaving people to die?
No. There has been no directive that blocks people from long-term care homes to hospitals. If they need to go to hospital, they will be taken there. It is a very difficult situation, I know, for family members when they're not able to see their loved ones that are in long-term care homes, except for if they're in dire circumstances and they're going to pass away. But we want to make sure that we can keep people safe there. We want to make sure that they get the supplies that they need and the care that they need. But if their needs have come to the point where they need to be on a ventilator, for example, they will be taken to hospital and they will receive the care that they need.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Hi, Premier.
Hi, Brian.
You have obviously been concerned about supply chain from the beginning, and your announcement today is about that as well. Mm-hmm. I'm not sure it's something that people understood at the beginning, but now that we're seeing the United States say no to COVID-19, You obviously have concerns about the food supply. Do you think that the public is understanding the need to keep certain industries open and certain parts of the economy going based on this? And how concerned are you about the food supply?
Well, I think we have a pretty good food supply right across our country right now. I'm always concerned, but I don't think the presidential order on the food, he was focusing on the food. He was focusing on companies like 3M and other essential items that people need for PPE. And I had a conversation. Matter of fact, I've talked to Penny, the president of 3M, twice this morning. I'm very, very concerned. Our order hasn't been fulfilled yet, and I just got to thank 3M. 3M's doing a great job. They're disagreeing with the presidential order, but physically they're kind of stuck. When you get the presidential order, you just can't ship items out. We're working through it. I know the federal government is working with the U.S. government to lighten that up a bit and let us get our supplies. But again, we're going to do everything we can to make sure that we have the supplies. I know the federal government have had a few issues getting supplies in from around the world, and it's getting tight. But I definitely need the federal government support on this. We've been working great together, and they're doing everything they can. But we have to get more supplies. We're relying on the federal government to get supplies flown in from around the world. It's absolutely critical. I just can't stress it enough that we need their support. We need it now. And I know I'll be getting on the phone again shortly after this press conference and just asking them when we can get our supplies. It's critical. And Health Canada, we have great people in Health Canada, and I know they're inundated, but we have to get Health Canada approval on these masks and a few other items that we have up there. So we have to rattle some cages in a good way, because I know everyone's under pressure right now. But we can't wait weeks for these approvals any longer. We need them. I've been saying this for the last few days. We're waiting. Well, patients are running thin right now. We need to get these approvals going until we can get our own masks produced right here with the company called Woodbridge. They're actually up in Woodbridge, Ontario, and get them producing it. I can't stand relying on other countries and other leaders when we have the capabilities right here in Ontario. As I said yesterday, we have the engineering might here, the technology here. We just need to get these approvals going and make sure that we have these companies up and running right now.
You've mentioned these masks from Woodbridge several times. Do you have any idea on when those might be approved from Health Canada or other products such as the ventilators? Have you been told, well, it'll be days, it'll be weeks, it'll be months?
Well, I've heard it's going to be a few days, but I've been hearing that for a few days, and when I hear it's a few days and a few days have gone by, I'm just all over this. Like literally, that's my 100% focus, getting these PPE items in, no matter what it takes, get these approvals. So again, I'm going to be on the phone, and I don't care if I got to call Deputy Premier, the Prime Minister 10 times a day. We need these items here. We need these approvals. Like yesterday, we need them. I can't stress it enough.
Next question.
Next question comes from James Moore from News Talk 1010. Please go ahead.
Hi, good afternoon. So on the issue of those protective masks, the Prime Minister said almost 50 million of them were on their way to Canada. Do you know how many Ontario will get and how they'll be distributed once they get here?
Well, hopefully proportionally, based on population. We're just close to 40% of the population. We would expect 40% of the items. I also heard the Prime Minister mention Quebec. I love Francois Legault, but he should get his fair share. We should get our fair share, and the rest of the country should get their fair share. And again, the federal government is doing everything they can. They're working hard. But, you know, if there's, you said 30 million masks, for 40%, it's 12 million. We need those masks. I just can't stress it enough. So again, I will be on the phone all day, all night if I have to. I'll be like a dog on a bone to these folks to get this thing going.
And do you think you could please clear up the rules for us on construction projects or specifically renovations in private homes? Would those be considered an essential service given what's going on right now, and are those businesses allowed to operate?
Yeah, I'll answer, then I'm going to pass it over to my Minister of Finance. He was working on the essential service list, but we have 45,000 families over the next few months that are expecting to get in a home. And if you know, even if it's only 2 people in the family, which I believe there's more than 2 people, but that's 90,000 people that will be homeless. So we just need to make sure that the homes that are weeks and maybe a month away, we get them finished and get people, make sure they have shelter. There's nothing more of an essential service than shelter and food. So we'll do everything we can to make sure that we move it forward. But pretty well, we've closed the vast majority of the construction trade down, any commercial, industrial. They had a food chain building going up. I won't name the food company, but one of the large food chain drive-through folks in Vic Fideli's area told me that stopped. Any construction, industrial or commercial, it's done. It's stopped. But I'll pass this on to the Minister of Finance.
Thank you, Premier. Appreciate the question and the request for clarification. We are, as you said, all industrial, all commercial construction will cease. Obviously, there'll need to be time to wind down those work sites, and that's the target for that is the end of the day today. Residential, all new residential, and in the case of renovations, which was your specific question, obviously there's situations where people have the permits and are approved, and there is work going on in people's homes, and so we can't leave people with holes in their roofs or issues related to that. So there is going to continue to be the ability to finish those. All of this has to be done, and we have to emphasize this. All of this, with the entire essential service list, has to be done within the guidelines that local chief medical officers of health have laid out, because it's critical that people maintain the appropriate physical distancing and that those work sites are safe. Just because we have the opportunity, because if there are questions, we also have a 188 number. So 1-888-444-3659. I'll say it again, 1-888-444-3659. I'm sorry. So 1-888-444-3659. So any businesses, as the Premier said, essentially most of the businesses are now being shut down, but any businesses that have a question, like the one you asked, could call that number to get clarification. Thank you.
Next question.
The next question comes from Kari Virma from CBC National News. Please go ahead.
Thank you, and good afternoon, Premier and Ministers. Just to follow up on the question of the PPE, what specific medical supplies are we running low on that we import from the United States? Are you concerned that those orders will not be delivered? And Premier, you alluded to say Ontario has a couple of million N95 masks on order from 3M. Can you provide a more specific number today? And can you elaborate a bit on your conversations with the head of 3M Canada?
Well, Penny's been absolutely fabulous. She really has. Her hands are tied right now based on the U.S. government. She knows how important it is, the Canadian market, the 3M, and she's doing everything she can. I think it's the overall broader picture, with our neighbors, our closest allies, the United States. And, when you sit back and you think of your allies and the wars we've gone through, and we've stood shoulder to shoulder fighting the same enemies, and now we have an enemy and we're at war, and they want to shut things down with their closest ally in the world. That's unacceptable. We're part of the family, if you want to call it that. There's no two countries that have a closer connection, that are more intertwined than the United States and Canada. And in a major crisis, they want to cut everyone else off. That is totally unacceptable. Just imagine if Canada had one item, and we all of a sudden cut the U.S. off, that they were in desperate need in a desperate time. I can tell you, Canadians wouldn't do that. Yes, I understand. They got to take care of their country. I get it. Just like I have to take care of Ontario, and the Prime Minister has to take care of Canada, and the rest of the premiers take care of their provinces. But this is just unacceptable. We're the two largest trading partners anywhere in the world, and to just say all of a sudden, it's like one of your family members. Okay, see you later. You go starve, and we'll feast on the rest of the meal. I am just so disappointed right now. We have a great relationship with the U.S., and all of a sudden they pull these shenanigans. Unacceptable. But again, as I said yesterday, we will never rely on any other country moving forward. We will get these approvals. They're going to happen quick. We'll be making our own N95 masks. We're going to make sure that we make our own ventilators, and the nitrile gloves too. We'll make our own, because I'm not relying on anyone else any longer when we have the manufacturing capabilities and the technology here and ingenuity. When the cards are down, you see who your friends are. And I think it's been very clear over the last couple of days who our friends are. And do you know who our friends are? Every Canadian, look in the mirror. That's who our friends are right now. But we'll make sure we get these masks going.
Thank you, Premier. Sorry, I'm going to try and squeeze in two questions in here. One is a follow-up to the point you made. Can you provide some details as to what specifically you're waiting on Health Canada approvals? And to the Minister of Health, when was the first directive to long-term care facilities about how to manage a COVID outbreak? And when did ministry officials tell long-term care facilities to separate the sick from the unsick? And can you provide some details on what the latest directives are to long-term care facilities?
So I'll answer mine real quick. Anything to do with health, be it medication or any health devices, have to go through Health Canada. They do their testing to make sure that, be it the N95, or as I said yesterday, they're called N96, to make sure they're safe for people to put on every single day in a medical environment, hospital environment. So we're waiting for their approval. But I can assure you, I'm all over this right now. And again, I want to thank the federal government for their support. We have a great relationship. But someone has to rattle some cages up there in Health Canada. They're great people, and I understand they're inundated, but it's not about business as usual. It's not about, a week goes by or 2 weeks go by. We need this in hours and days. Put everything else aside. This is going to protect lives. It's going to save lives, not just here in Ontario, across the country. And we'll be on to them. I promise you that. I'll pass this over to Minister Elliott.
Well, as always, we have been relying on the advice and counsel of the Chief Medical Officer of Health for Ontario, and we knew as we saw what was happening internationally with COVID-19 that Ontario wouldn't be spared. We knew that it was going to be coming into our province. The Chief Medical Officer of Health gave us his advice, and we've been following it since then. We were the first to close the schools. We declared the emergency order on March 17th. We've been narrowing the scope of essential businesses, but certainly as far as long-term care homes were concerned, as well as retirement homes and other places where people are living in a congregate setting, we knew that they were going to be particularly vulnerable. So we have been watching out for them ever since. We know that there have been some outbreaks, and we have to increase our precautions, increase our testing, do our COVID follow-up testing. We're doing all of that, and we want to make sure that if people need extra care, they're being helped by their local public health units and by sending in additional healthcare resources where necessary. So we know as we go forward, we know that as things get, we get more and more cases of COVID-19, which we hope will not increase tremendously based on the statistics that we released to the public yesterday. We know that we're going to have to really reinforce the protections around vulnerable people, and I would say that the people in our long-term care homes are probably the most vulnerable. So we are building that iron ring around them.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Hi, Premier. I was listening to the Prime Minister this morning, and he said that they're not looking at any retaliatory measures or measures that are punitive against the United States when he was asked specifically about the 1,000 nurses who live in Windsor, Ontario and go to Detroit, Michigan to work each day. I'm wondering, would you like to see a little more pressure put on the Americans? I know you're very disappointed in the president, and you've been speaking to Ambassador Lighthizer about this. Do you think that maybe Ottawa needs to step it up and put a little more pressure and remind Americans how much Canadians do for them, how the pulp actually, Canadian pulp helps make those N95 masks at 3M and so on?
Yeah, we do, just on fuels, we do over $80 billion a year, and automobiles, I think $50 billion, and other manufacturing, I think it was $30 billion. But it shouldn't come down to this. You know, it shouldn't come down to this. Yeah, you're right. We have 1,000 nurses leaving Ontario that we're in desperate need, going to help Americans. And you know, there's no one that loves America more than I do. And all the hundreds of thousands of snowbirds and businesses that go and back and forth, I say we're one big family. But they've cut out one part of the family now. It's not right. Absolutely, I'd be all over the federal government in the U.S. and show them how important our relationship is. And still, I'm so disappointed in what they're doing right now. And I've voiced my opinion. I'll leave that up to the federal government to take care of the U.S. federal government. But you're right. How would the people in Michigan feel, the governor in Michigan, if all of a sudden we said, okay, the 1,000 nurses, we're in desperate need. You need to stay here in Ontario, and you aren't going down to Michigan. You know, would that be a wake-up call for them? But it shouldn't come down to that. It shouldn't go to from tit to tat, back and forth. It just doesn't work. Just work with us. We're stronger together than we are separated. We are stronger together. There's so many natural resources here in Canada that keep the U.S. machine moving. And we're you know, my theory is, you know, united we stand, divided we fall. But Canada will always be united. And again, I go back to what I'm saying. Never again are we going to rely on any other government.
The other thing I wanted to ask you about, Premier, the Prime Minister, you alluded to this earlier about the Prime Minister mentioning Quebec and getting a share of those masks, but he didn't mention Ontario this morning, which I thought was telling, and I think a lot of us listening thought was telling. Are you concerned that maybe Ontario is not going to get its fair share, that you know, as has happened in this federation over the last 150 odd years, maybe Quebec will get preferential treatment over Ontario?
Well, I hope not. I really, really hope not. I want the Prime Minister to keep his word and have a phenomenal relationship with the Deputy Prime Minister. When they tell me something, I believe them. And I believe them to come and come forward, and we need 40% of the supplies. It's very, very simple. If we were 10% of the population, I'd be saying we need 10% of the supplies. But we're relying on the federal government to come through with the numbers that we all expect. And I hope to God that they start dividing this up equally, because we've all been working well together. But remember, my job is to protect the people of Ontario, and I'll always protect the people of Ontario. And I guess the people of Ontario and the manufacturing businesses, and I've come up here so many times and said, when we get these masks going, when we get the ventilators going, we aren't going to just take care of the people of Ontario. We're going to take care of the people of Canada. That's what we do here as Ontarians, making sure that we take care of our brothers and sisters across the borders of different provinces. And again, that's what I believe we should be doing. So does it concern me? Yeah, it's concerning me, especially as the days are going by and we're seeing dribs and drabs of shipments coming in. So, but we'll work with the federal government and continue having a very good relationship with them. But I just, I know they'll keep their word.
Next question.
The next question comes from Matt Ingram from CHCH News. Please go ahead.
Thanks for taking my question, Premier. Niagara Falls MPP Wayne Gates is telling us about a retirement home in Niagara Falls that held a pub night event for residents last Saturday. Multiple residents have tested positive for COVID-19 and 3 have died. I was hoping to get your reaction to the management of this facility deciding to hold a pub night during this time.
I heard about this. I got a call from one of my ministers last night, and the first thing out of my mouth was exactly what you said. You got to be kidding me. They're having a pub night after warning, and now they're in the situation they're in. Well, we're doing everything we can to support them. Everyone makes mistakes. We've got to put that to the side and support these people. So we have the Minister of Seniors and Disabilities, Minister Raymond Cho, all over this right now. But folks, come on. And on top of it, in a seniors facility, having a pub night, like, I don't know. Most people are using common sense, but folks, you can't have pub nights in a seniors building when we're saying we need to put an iron ring around the seniors and long-term care. It just can't happen. So, but we're there to help them, and I'll be reaching out to Wayne this afternoon. But I've heard about this late last night.
And my follow-up to that would be, do you think that the retirement home should be investigated when you say that the minister is all over this? Is that what you mean? Is there
well, he's there to help them, but they have to answer some questions. Who came up with this idea of having a pub night when we're in the middle of a crisis and we're telling everyone social distance and make sure you stay at home, or in that case, stay in the room as much as you can. But yeah, no, they're going to have to answer some questions. That's for sure.
Next question.
It's really unbelievable if you think about it.
Next question.
The next question comes from James Murray from Net News Ledger. Please go ahead.
Premier, thank you for taking my call. It's been a lot of Southern Ontario media. It's good to be from Thunder Bay and Northwestern Ontario to ask you. First of all, we're getting a lot of concern across the Northwest over cottagers and campers coming into this part of the province to stay in the area. What can be done on this? From Kenora area, you get campers who come in from Winnipeg, and in the Thunder Bay area, we get a lot of people from the United States.
Yeah, no, I've heard this. I've been on this with Minister Greg Rickford, our minister and representative up in Kenora. I was on the line last night with them as well. Number one, we have to get the message out to the cottagers. Please don't go up to your cottage. And with our friends in Manitoba that are coming over to Kenora, as Greg said, if this wasn't happening, absolutely, we welcome them. But they can't be coming into Kenora, as Minister Rickford said last night. I think we have a couple beds in the hospital, ICU beds, and God forbid something ever happens to someone in Manitoba. We're obviously going to take care of folks, but why put the strain on a great town like Kenora, or even put a strain on the grocery supplies that they have up there? So I'm pleading, I'm asking people, just stay at home as much as you can. It's unfair to these smaller towns that don't have the capacity to handle it. And hopefully, if at the borders, they shouldn't be coming up through the Canadian border in the first place, unless it's an essential service, it's a job, or essential goods are being shipped across the border. Our American neighbors should not be allowed up here right at this time. We welcome them any other time, but at this point, please just stay down in the United States.
Thank you, Premier. And in follow-up, to shift the direction a bit, we're getting reports up here in Thunder Bay for Thunder Bay District Housing that is doing evictions of some tenants in some of the public housing. The other week you said that there are no evictions and the Sheriff's Office is not working on that right now. What message would you share on evictions and tenants and adding to the stress of low-income people?
I thought we were pretty clear on the eviction, so now I'm going to follow up with the folks up in Thunder Bay. We'll be all over this, and I'll jump on this today. That's the first time I've heard that. Again, we pass legislation. You don't get evicted if you don't pay your rent. In saying that, I've said it over. If you have a job, you can pay rent. Pay rent. I repeat it. Pay rent. But I'll be on these folks up in Thunder Bay.
Okay, that's all the time we have.
Okay, thank you, everyone. Enjoy the weekend to the best of your ability. Thank you.